Hello, I'm Kim. There are many different contraceptive methods available. How do young people like me know which one to choose? It's a time of enormous change, both physically and emotionally, and we face new challenges at every turn. Many women in their 20s and 30s seem to know their contraceptive options well. There are so many different methods of contraception available, but we need to know how each one will affect us. Some of us might not want anyone to know we are having sex, because we might be judged or criticised, which I think is not okay. We can get advice and information from many different sources, such as our mothers, our friends, the internet, and social media. But how do we know who to listen to? And how can we be sure what we hear or read is true? Take me, for example. When I needed contraception for the first time, I thought about visiting my healthcare provider to discuss my options, but I was worried about what to expect and felt overwhelmed. So I decided to choose on my own. I asked one of my friends what she was using to avoid a pregnancy, but I didn't really understand how her contraceptive method worked. So I was tempted not to bother with contraception at all, but then I would definitely be at risk of getting pregnant now, which I don't want. So I realised I needed to go back to my healthcare provider because I needed information to help choose the right method of contraception for me. My healthcare provider reassured me that our discussion was confidential and we talked freely about my medical history, my lifestyle, and my plans for the future to give my healthcare provider an idea of which methods might suit my needs. I had the opportunity to ask questions about the different methods, and my healthcare provider explained all of the things I didn't understand or had never even thought about before. Based on everything we discussed, my healthcare provider helped me choose the best method of contraception, one that fitted with my body, my current situation, my goals, and how I want to live my life. And when my healthcare provider helped me with my choice, I really understood how it worked and how to use it correctly. Now I am certain that I will be able to avoid getting pregnant. My healthcare provider also told me to come back with any questions or concerns that might come up. I now feel confident that I've chosen the right method of contraception for me. I have some plans for my life and want it to be my decision whether, when, and how many children I want to have in the future. Talking to my healthcare provider turned out to be easier than I thought and helped me to have more control of my life. Why don't you ask your healthcare provider to help you as well?